The federal government is promising swift action after a royal commission criticised its response to the coronavirus pandemic in aged care facilities. The recommendations have been well received by many in the sector, but there are fears the government won't act quickly enough to fix the problems. Political reporter Jade McMillan joins us now from Canberra. Morning, Jade. What's going to change as a result of this report, do you think?
Well, the Aged Care Minister, Richard Colbeck, has accepted all 6 recommendations and says that progress has already been made on 4 of them. The Royal Commission wants to see a national COVID-19 plan in the aged care sector, finding that the measures taken by the federal government in response to the pandemic were in some cases insufficient. It also found that there were confused and inconsistent messages and that too often family members and healthcare workers didn't know who was in charge. The Royal Commission also wants infection control officers in every aged care facility and more focus on mental health services, including more funding to ensure that there are enough staff members so that aged care residents can still receive visits from family and friends. The government has announced $40 million funding to implement these recommendations, and Home Affairs Minister Peter Dutton says there will be further announcements once the Royal Commission's final report is handed down early next year.
I think everybody's sorry for the situation in aged care, and it's been that way for a long time. In fact, it was one of the first acts that Scott Morrison did when he came into the leadership of the government. He called for this Royal Commission because nobody was happy with the band-aids that have been applied for well over a decade or two, and the 6 recommendations have been accepted by the government. We'll implement those. But as Ian points out, there's a lot more work to be done, and you'll see that in the budget, in next year's budget, and there's a big change coming in aged care.
Jade, will the recommendations, though, go far enough?
Well, many in the aged care sector have welcomed this report. They say that it will make a real difference if these recommendations are implemented quickly. Others, though, argue that the government has been let off lightly here, that there's not really anything new in the Royal Commission's report, and that many will still be left wondering why the sector was unprepared in the first place and why changes weren't made sooner. Labor's Shadow Minister for Aged Care, Julie Collins, says that the report shows the government didn't do enough to protect aged care residents, and she says it needs to act urgently now.
We need to see in the budget next week is the government deal with both the interim report's recommendations and the Royal Commission's recommendations in terms of COVID-19, whilst we await the Royal Commission's final report in February next year that has the major reform in it. The Royal Commissioner said this needs to happen and needs to happen now. There are no more excuses for the government. It can no longer take months and months to do things. It needs to get in there and get it done.
The Royal Commission has asked the government to report to Parliament by December the 1st on how it's implementing these recommendations.
The Australian Nursing and Midwifery Federation has welcomed the 6 recommendations but has concerns. Federal Secretary Annie Butler joins us now. Morning to you. What are your concerns, Annie?
Well, thanks very much, Lorna. While we do, as you say, we welcome the recommendations from the report, we are just concerned that around staffing, it just doesn't go far enough. I have to say that we are disappointed and concerned that once again the Royal Commission has used the term adequate, that there's a need for adequate staffing to make sure that residents can get visitors in nursing homes, etc., and that there's enough for infection control processes, etc. But the word adequate is a large part of how we got into this problem in the first place. There's been chronic understaffing in the aged care sector for years because the Aged Care Act just says that nursing homes need to provide adequate numbers of staff. Therefore, many providers just set their own staffing ratios just based on supply, based on what's available, based on what they're prepared to pay for sometimes, not based on meeting the care needs of all residents.
Do you think there should be a quota, a certain number of staff per resident?
Absolutely we do. We've done a significant piece of research that we released in 2016. We've been lobbying the government around that, the evidence that we have that says precisely what's needed across nursing homes. It's not a static fixed, blunt ratio we're talking about. What our staffing model is evidence-based that allows for numbers to be flexibly applied across a nursing home, where those with the lowest care needs get the lowest number of hours and the highest care needs get the highest number of hours, with a division of registered nurse time, enrolled nurse time and personal care worker time.
Okay, it's interesting to hear you make that distinction between the levels of care and expertise that are being applied. And we know during the latter stages, not initially, but certainly with the second wave, that more medical professionals rather than care workers without those nursing qualifications were brought in. Has that system worked well? Would it be sustainable?
It would be sustainable if we were able to implement it. And I understand the Commission's approach of now is not the time to blame, there's too much at stake. While many people are rightly feeling probably very angry, we just need to get on and make sure we have a system in place. We have seen the dilution of the skills mix in the sector over the last 15 years. In 2003, we had 20% of the workforce was registered nurses. It's now down to around 14%. We say it should be 30%. If we had that kind of expertise in place with enough care workers working in the team together, we could never have fully stopped COVID-19, but we could have done a lot to control it and a lot to prevent the absolute tragedy that has occurred. So there's nothing to stop us now acting on the mandated minimum staffing levels needed and starting to get them into the sector, regardless of COVID or not. We can start working on that now, and that's our disappointment, is that hasn't been suggested.
But Annie, you'll know, and we've heard it many times in the Aged Care Royal Commission when we followed the hearings there, it does come down to cost, that when you get fully qualified medical staff in there, it costs more, and therefore those costs have to be met somewhere. The government is pledging more money. Is it going to be enough to up those numbers a bit, do you think?
Well, we have to see what they're actually pledging first. We're not at all suggesting that it won't cost money. Indeed, we did a cost-benefit analysis of what full staffing would cost. It will cost a lot of money. It will be offset by a lot of savings in, things like productivity costs, tax take, that kind of thing, but also prevention of higher level problems, prevention of transfers to hospital, all those sorts of things. One of the things that we are very concerned about is that yes, it will take more funding, but the government should only give funding to the sector if it is absolutely transparent and accountable where that funding is going to go. We know that the Royal Commission recommends immediate additional funding for the extra nursing, extra staff, extra all the other things that they're recommending be implemented. But where's the money that the government's already supplied? Where has that gone? I've written to the Aged Care Minister now 10 times seeking clarification on a whole range of matters, and we still don't know where the money they've put right now in the last 6 months has gone. So yes, it needs funding, but we absolutely need mechanisms for transparency and accountability first. We always say that one of the best ways to do that is to mandate minimum staffing levels, because then we know that the money goes direct to care provision.
Okay, let's talk about the emotional side of this. Firstly, for the patients and the limited access they've had to families and friends, and then as well on the teams that you work with, the nursing and midwifery teams, about dealing in those environments and the emotional toll it's taken on them as well. Yeah.
The grief and the trauma is going to last for a long time, and that's across a whole lot of layers. As you know, and as the Commission's report points out, nursing homes have locked down all across the country. We hear not just from staff, but we also hear from families. You know, not even in Victoria, their relatives have died in the last 3 months. They haven't been able to see them. They haven't been able to go to funerals. They haven't been able to comfort them. The grief of the actual resident dying, of the family, then the staff who, unfortunately, with the understaffing that persists across the sector, rely on families to assist. Also, to assist with actually practical things, but emotionally and mentally, more than anything, for the family to be there, especially for people with conditions like dementia who need the comfort of familiarity, the reorientation to people and place. All of that has just is absent. And so there's that level of grief and loss involved. Then if we look at the situation of the nursing homes that experienced outbreaks in New South Wales and then the Victorian situation, particularly for the staff who had to be removed, the staff who carry the feelings of when they had the infection themselves, what they might have caused, then all the volunteer staff who've come in, the level of distress that they have explained to us, the things that they've had to see, what they've dealt with, is going to cause them trauma for months and months.
Yeah, and as we know, Annie, nurses have come from other parts of Australia to go in and help in Victoria. South Australia has sent a fair few nurses out, and there are some that feel very devalued after the environment, the situation that they've been in. They've gone and worked for 6-7 weeks in these aged care homes. They've given everything. They've been away from their families. They've put themselves at risk, and then they've gone back to their various states, and they don't get paid during their 14-day quarantine period, which is compulsory, and they feel like that they've been put everything out there for others and for the state, and they're not getting anything back for it.
Yeah, it speaks volumes, doesn't it, to what you actually what actually does respect mean. So we've had a number of issues with how quarantine will work for those returning nurses across the country in different states. Had some troubles in WA, different versions in Queensland, but those things have been settled. I have just become aware that these South Australian nurses won't be paid for their quarantine time, which to us is just disgraceful. As you say, they put everything at risk, and at the drop of a hat they put their hands up to come over here. I'm in Melbourne, to come over here and put, as you say, themselves at risk, their family at risk. They didn't sign up to work in aged care, but the thing is, as nurses, what they do is they sign up to provide care wherever it's most needed. And so it's really hard for them and for us to listen to people say, oh, we love nurses, we thank you so much, we respect you. Respect means proper pay, proper conditions, listen to them when they have something to say, and allow them full participation in the work that they do and allow them to do their work properly. And so that means pay them for their quarantine time.
Annie Butler, thank you very much.
That's a pleasure.